Joining us now because he said yes to coming back, and I've been happy about it all day, is Dr. Ernest Patti. He's the senior emergency medicine physician at St. Barnabas Hospital in the Bronx. Dr. Patti, I really appreciate you coming back a week after we last spoke. Thank you so much.
My pleasure, Rachel. Thank you for having me back on. I appreciate it.
We've been watching some of the metrics kind of turn in the right direction in New York writ large. But you said today at the start of your shift that St. Barnabas is still full, still at capacity. Are things different this week compared to last week?
Well, I definitely felt that way during the week, Rachel. When I came in for my shifts in the middle of the week, we happened to be on divert status as well for a bit, and we seemed to be decompressing the emergency department. You spoke to one of my colleagues yesterday, Dr. Chris Grantham, or your MSNBC did, forgive me, and he had mentioned that the ICU is still running at max capacity. It is, but I've noticed today that the volume coming in has slightly decreased. I didn't pronounce anybody today, which was wonderful, and we didn't have to put very many people on ventilators today. It was actually a day where we felt maybe we were plateauing out a bit, and we're very optimistic. We still are getting sick patients in because I still had a number of sick folks, but not to the extent that I reported to you last Friday.
I'm so glad to hear you say it, although I recognize the situation is still incredibly taxing. Is anything improving in terms of patient prospects? I mean, by the time they get to you in the ER, I know people are in trouble. They don't end up there by accident. But with this incredible volume of patients that you and your colleagues have seen, do you feel like you've learned anything in terms of how to maximize patient outcomes, how to optimize what's going to happen in terms of outcomes for these patients over time?
Well, we have learned a number of things. We've learned, there was a lot of information being sent back and forth from institution to institution, trying to, give colleagues hints or helpful ways to approach the patients. A lot of it revolved around PPE and creative ways to use it and reuse it. Others, though, dealt with the way in which we actually treated these folks as far as how much oxygen to put them on, what goals to set our oxygenation levels at. And a lot of those things have been helpful. We've learned about giving intravenous fluids, how much to give, how little to give, and how to approach this whole process when the folks come in. So it's definitely been a steep learning curve for us. We've learned a tremendous amount. What we do know is, though, that the folks who come in that have lots of comorbidities, meaning other illnesses like COPD, asthma, diabetes, cardiopulmonary issues, obesity, those folks tend to be more challenging because they present other problems in addition to having the COVID-19 infections. So, yes, we're learning a lot. Every day I'm learning something. I'm a lifelong student, Rachel.
Well, your position on the learning curve is going to be a position of incredible power and is going to be an incredible asset to medicine. I feel like you and your colleagues, seeing the number of patients that you've seen, seeing the volume that you've seen, when other places in the country, I was just talking with the governor of Illinois a moment ago, when other cities have patient apexes, I feel like you and your colleagues are going to have so much to offer in terms of best practices. Does the system of medicine and emergency medicine work in such a way that you'll be able to share this with your colleagues around the country?
Definitely. We are, all of us, I know many of my colleagues that I work with. Remember, I told you it's a team sport, emergency medicine. And the team doesn't just necessarily live within the four walls of your hospital. The teams lie in the greater good for the United States. I mean, we all are in communication with our different medical societies and groups and circle of friends, and we definitely share the information. It's been a really, really amazing experience. I do have to tell you, though, we did get a bit of bad news. And when I was talking to some of my senior members of the hospital as well, we actually did lose so far 4 staff members at our hospital, in addition to Dr. Verrier, who we mentioned last week. So it's been a battle for us where we've done a lot of, leaning on a lot of each other. We're leaning on each other because many of us knew all of these staff members quite well. You know, like I said, we're a big family at St. Barnabas, or as I affectionately refer to it as the barn. You know, so it's been a challenge.
Dr. Ernest Patti, Senior Emergency Medicine Physician at St. Barnabas in the Bronx. I am sorry for your loss. I'm thankful for your sacrifice. Thank you for your time tonight, sir.
It's my pleasure. Thanks for having me. And everyone should please remember to practice social distancing, check in on all your relatives and loved ones, and really, really practice good hygiene. It's super important. And one day I'll tell you a funny story about growing up with my kids. I noticed hygiene was decreasing years ago in the general population. And now I guess we're paying the price.
I will have you back to tell that story. Thank you, Dr. Patti. I appreciate it. All right, we'll be right back. Stay with us.
Thank you.